hernia or any kind of hernia is basically the weakness of that particular wall. For example, when you're talking about the tummy hernias or abdominal hernias, so that is a time when the lower abdominal wall is little weak, and that happens because it is kind of a defect which is present since birth, and sometimes it is very easily observable at the time of birth or few days after birth. Sometimes it is not noticed till the child becomes 1 to 2 years of age. So we can group this as in boys and girls, because in boys sometimes the swelling are very obviously observable, as they are also associated at times with hydrocele. Hydrocele is the testicular swelling. So many times the first thing they notice is that the testes are enlarged, and when we actually examine, there is a hydrocele, that is the water in the testicle, as well as there is a passage which is having a weak wall. But such kind of inguinal hernias are also common in females. Sometimes they are so big that they can be observed even at 2 to 3 months of age. Typically, when the child cries, the child is in the lying down position, and with the cry, the intra-abdominal pressure increases, and so the defect pops up like a balloon. And when the child stops crying, it becomes normalized. The wall or the abdomen becomes as normal as it was. There is nothing scary. When that pops up, the parents generally become anxious. But what is more important is that the time of operation. Nobody is going to operate immediately upon the baby unless it's an emergency. They wait for the weight gain and the right time. And many times this laparoscopic interventions can be done, which are easy. So there is nothing to worry about. Warning signs, I would only say, if the hernias popping up swelling does not go back inside the wall, even when the baby has stopped crying, or it becomes red, and that is the time when it becomes an emergency, that there is some other part inside the body, like your bowel, means the intestine, or there is what we call omentum, which gets stuck up inside, and then that needs an immediate intervention.
Follow us to stay updated on debates, discussions, facts, and tips about health. Click on the subscribe button and the bell icon for latest updates.